Greater Baltimore Prosthodontics has more than 30 years of experience with reconstructing and restoring complex prosthodontic and periodontic cases. It's also been voted top dentist in Baltimore by Baltimore Magazine. Joining me now are Mike Rostemi and Michael Lenan of Greater Baltimore Prosthodontics. Welcome.
Welcome.
Thank you for having us.
You had me tongue twisting there. Prosthodontics, periodontics. Tell me what you guys specialize in.
We specialize in reconstruction of the mouth. Prosthodontics is the specialty in dentistry that is involved with basically creating prosthetics in the mouth. Dentures, partials, crowns, and you go to extra training in order to become a specialist in that field.
That's what I was going to ask you, because I know at your practice extra training is it's very, very important to both of you. Talk about what those steps were for you in your careers.
So I'm a periodontist. I'm a board-certified periodontist, and periodontists deal with gums, bone, and we place implants. We do gum surgery for patients that have gum disease. For my career, I did 4 years of dental school. Then I did a year of general practice residency at Hopkins. Then I went to private practice for a couple of years, and then I went back for 3 more years of surgery training.
Wow.
Yeah.
That's a lot of school.
Yep. It was fun.
Yes, and then you said an extra.
I did 4 years of dental school and then 2 extra years of prosthodontic training.
So you really do go above and beyond at your practice, in part because of your patients and your clientele. I know that you deal with a lot of older patients. Talk about some of their needs and how you treat their needs there.
So the older patients, the main difference that you're going to see is, one is the health. Some patients, you know, they're really healthy and they're doing well. Some patients, they're going to be taking different medications, so you got to learn some of the medical field also. The other difference that you see with the older population is because some of the medications and because of just natural aging, you're going to have less saliva in the mouth. And saliva is our protector of the teeth. And so you have to watch out for things that when you don't have the saliva, you're more prone to get decay, more prone to have any dental issues, so you got to watch out for that.
So you really pay attention to your patients and what other medical factors outside of their dental factors might be impacting their mouth and their health of their teeth.
Well, as far as the overall health, you know, they used to say the mouth is the gateway of the body. You know, there's a lot of things that you see that patients that have diabetes, if they control the gum disease, you know, there's been research papers that shows a 10% decrease in A1C level just by controlling the periodontal disease. There's some correlations and links between periodontal disease and heart disease. Now, if you look in the literature, there's almost for every disease out there, there's some correlation between the bacteria in the mouth and the systemic involvement.
So I was going to ask you, how does one become, you know, top dentist in Baltimore? But I think you're already telling us. But how did this come about?
The way it comes about is Baltimore Magazine has kind of created this environment, and our peers all vote on dentists, and we were fortunate enough to be recognized in our field as one of the top.
Well, as you should. I know that lots of our viewers right now are watching and they're thinking, you know what, this is a practice that I need to go to. So you can do that. Just go to gbpdental.com for more information. Call the number on your screen. And the best part, mention Midday Maryland, and what? They get a free consultation?
Yes.
Correct.
Free is my favorite price. I say it here every day. Thank you guys so much for being here. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.